Welcome back, my people. We are still dealing with our very broad topic, or one of the longest topics we have ever discussed about fibroids. And in this video, we are going to discuss about frequent questions asked about fibroids, or some of the questions that healthcare workers or healthcare givers come across during their time of duty or when interacting with their clients. And before we continue, guys, for those who have not subscribed, let's continue subscribing, sharing, and commenting on our videos so that they may reach as many people as possible. And as we promised, we will continue educating you and giving you all what you want and in time. So let's talk about these frequent questions which healthcare workers come across from the clients. Number one, a client can ask you, how do you shrink fibroid with herbs? How do you shrink fibroids using herbs? So the answer is so simple and straight. So if a client asks me this question, this is the answer I will give her. That as with any type of medication, always consult a healthcare provider before using the herbs or the supplements. Drinking green tea could be helpful in relieving fibroid symptoms. So if a client asks me how she can shrink the fibroids using herbs, simply I will answer this. As with any type of medication, always consult a healthcare provider before using the herbs or the supplements. A point to note, drinking green tea could be helpful in relieving fibroid symptoms. Another point to note, a 2013 or 2013 study suggests that the flavanol EGGG, the flavanol EGGG found in green tea may reduce size of uterine fibroids and improve symptoms of anemia and blood loss. A study carried in the year 2013 suggests that the flavanol EGGG found in green tea may reduce the size of uterine fibroid and improve symptoms of anemia and blood loss. Another question you might come across is, how fast do fibroids grow? And this is a very common question. How fast do fibroids grow? So, growth of fibroids can vary and be difficult to predict. Growth of fibroids can vary and it's very difficult to predict. It's hard to predict within 1 year what size is it going to grow. So, one study indicated that average fibroid growth is 89% per 18 months. 89% per 18 months. This means that a 2 centimeter fibroid, which is about a size of a blueberry, is likely to take 4 to 5 years to double its diameter. Note this, the study indicated that small fibroids grow quickly than larger fibroids. The study indicated that small fibroids grow quickly than larger fibroids. Another question you will come across: why do fibroids cause heavy bleeding? And this is very obvious. When you have fibroids, you must have heavy bleeding. So why do fibroids cause heavy bleeding? The answer is simple. Pressure of fibroids against the uterine wall cause endometrial tissue whose lining is shed during menstruation to bleed more than usual. Pressure of fibroids against the uterine wall cause endometrial tissues whose lining is shed during menstruation to bleed more than usual. So the bleeding is always increased by the pressure, by the pressure of the fibroid against the endometrial tissue whose lining is shed during menstruation and this makes it bleed more than usual. Another reason why fibroids cause heavy bleeding is that fibroids don't allow uterus to contract. Fibroids don't allow the uterus to contract well during and effectively to stop menstrual bleeding. Contraction of the uterus makes the capillaries to close down and stop bleeding. So when there is a fibroid inside there, the uterus won't be able to contract well. So this may lead to the increase in the bleeding during menstruation. Another reason is that fibroids produce growth factors or protein that stimulate the blood vessels of the uterus, causing more blood in the uterine cavity, leading to heavier periods. So the third reason is that, let me repeat, fibroids produce growth factors or proteins that stimulate the blood vessels of the uterus, causing more blood in the uterine cavity, leading to heavier periods. The fourth question you may come across: how do you deal with fibroids during pregnancy? How do you deal with fibroids during pregnancy? Note: hormones released during pregnancy to support growth of the baby can also cause fibroids get bigger. So the hormones produced by the body of a woman during pregnancy to support the growth of the baby can lead to overgrowth, or they can cause the fibroids to grow bigger. Another point to note: larger fibroids increase risk of breech presentation or increase the risk of the baby coming out or presenting with the legs or the buttocks. So larger fibroids increase the risk of breech presentation by preventing the baby being able to move into correct fetal position. This marks the end of the second video today, and in our next video we will be discussing about the third type of fibroid, which is called pedunculated fibroid. And I think that will be the final part we will tackle concerning this very big and wide topic about fibroids. So guys, let's continue keeping the support on. Let's continue subscribing, liking and sharing our videos so that they may help your brother, your sister or your relative. Let's meet in the next video.